The hip adductor muscles, their origin, insertion, and actions. The hip adductor muscles are a group of muscles located at the inner thigh. The group consists of several muscles: the adductor magnus, the pectineus, the adductor brevis, the adductor longus, and the gracilis. Let's take a look at the origin and insertion points of the different hip adductor muscles. First, we can see that the adductor magnus inserts distal attachment at the medial lip of the linea aspera and the adductor tubercle of the femur. It originates proximal attachment from the inferior ramus of the pubis and the ischial tuberosity. The adductor magnus is commonly divided into an anterior portion, which also makes up the superior part of it, and a posterior portion which inserts inferiorly. Next, we see the pectineus. It originates from the superior ramus of the pubis and inserts at the oblique line, extending from the base of the lesser trochanter to the linea aspera on the posterior surface of the femur. The adductor brevis originates from the outer surface of the inferior ramus of the pubis and inserts at the proximal portion of the linea aspera. Next, the adductor longus originates from the anterior surface of the pubis and inserts at the middle third of the linea aspera of the femur along the medial lip. Last, the gracilis originates from the inferior ramus of the pubis and inserts into the medial surface of the proximal tibia via the pes inseronus. The innervation of the hip adductor muscles comes from several different nerves. The adductor part of the adductor magnus innervation comes from the obturator nerve, L2, L3, L4, and the innervation to the hamstring part comes from the sciatic nerve, tibial division, L4. The pectineus innervation comes from the femoral nerve, L2, L3. The adductor brevis innervation comes from the obturator nerve, L2, L3. The adductor longus innervation comes from the obturator nerve, anterior division, L2, L3, L4. Gracilis innervation comes from the obturator nerve, L2, L3. The main action of the adductor muscles is to adduct the hip. Several of the muscles in the group can create hip flexion: the adductor longus, the gracilis, the pectineus, the adductor brevis, and the adductor part of the adductor magnus. The adductor magnus hamstring part, the adductor longus, and the adductor brevis can internally rotate the hip. The hip adductor muscles also act as important pelvic stabilizers and assist in stabilizing the lower limb during single leg weight-bearing exercises. To strengthen the hip adductors muscles, utilize hip adduction at different angles in exercises such as the Copenhagen hip adduction. To stretch hip adductors muscles, hold your hip in abduction.